My name is Segkwele. I am the curator based at the Adler Museum of Medicine at the Wits University, Faculty of Health Science in Parktown, Johannesburg. This event is a joint event with the Wits Department of Speech and Pathology and Audiology. And I'm now handing over to my colleague, Catherine Benz, a medical and a health historian. I thank you.
Thank you so much for that, Sepeke Segkwele, my colleague, and welcome everybody to this webinar. We're going to kick off before I introduce you to our wonderful panelists with a very short video that was provided to us by Dr. Shelly Chadha. She is the technical officer leading work on ear and hearing care at the WHO organization, WHO. Over to that video, and then I'll introduce you to the others.
Hello, everyone. Greetings on the occasion of the World Hearing Day. This year, this day marks the launch of the World Report on Hearing. Requested by our member states, this report comes with a very clear message. The number of people that still have unaddressed hearing loss and ear diseases is really unacceptable. Urgent action is needed to prevent and to address hearing loss across the course of life. Such action will bring benefit to people that have hearing loss, but it will also bring financial gains for the society at large. And so we must act. We must act to integrate people-centered ear and hearing care within the national health plans for universal health coverage, so that the dream of hearing care for all can become a reality.
It was wonderful to hear that ringing endorsement of World Hearing Day from our colleague, Dr. Shelly. And now I'd like to introduce very briefly our four speakers today. First up is our colleague, Dr. Kibachio Joseph Mwangi. He is the WHO medical officer in charge of the non-communicable diseases and mental health cluster at the WHO country office in South Africa. His presentation will be followed by Dr. Victor de Andrade, our colleague here at Wits. He is an audiologist and a senior lecturer in the Department of Speech Pathology and Audiology, and one of the main organizers of today's event. Then we'll follow with Mr. Heaton Bauer. He is an artist, an architect, and an accessibility consultant based right here in Joburg, and he's also a profoundly deaf person with bilateral cochlear implants. What a pleasure and an honor it is to have you here today. And finally, our last presenter will be Ms. Ketu Kutula Makutswane. She is a South African Sign Language interpreter at the University of the Witwatersrand Disability Unit and is very involved in access for hearing loss and people across the spectrum in our country. We welcome you all. Now, without further ado, let's go over to Dr. Mwangi's presentation.
Thank you so much for putting this together. And I don't know whether we greet each other with a happy World Hearing Day. Well, I guess it's befitting considering the burden of hearing loss. So when we have something to celebrate, then it's befitting that we look at the milestones that we have done. Today, we are launching this World Health Report on Hearing. And as my colleague, Shelly Chadha has just talked about it, it is a critical moment. And its importance is how much of what is contained in this report we are going to transfer into some policy utility and to make the lives of those living with challenges of hearing and their communities at least worth a while. So I will go through my presentation quite quick. Thank you, Victor, for the questions that you shared. I've tried to integrate my answers across the presentation. So I was asked to give a little brief on the ear and hearing care, give it a public health approach. I was asked to look at issues around justice and access to ear and hearing care. Some of my colleagues might even have some better insights on this, so I'll just mention a few things. And of course, I'll do a little justice to the World Report on Hearing being launched today with the theme of hearing care for all for the day. We will just do a minute or two of COVID-19 and the impact it has had on ear and hearing care. We are living in unprecedented times. COVID-19 has turned our public health response up and down. And here we have to reflect on how that has affected ear and hearing health. And of course, I will finish by looking at the role each of us have. And since we are hosted by the university, then Victor and colleagues, I will be telling you what we think you should be doing as universities to make hearing and ear health leap to the next level as envisaged in this report. So as the pandemic is going on, there is other many underlying pandemics that are now unearthed by the COVID-19 pandemic. The COVID-19 pandemic has unearthed the burden of especially non-communicable diseases, issues like hearing and ear health that have been left, with very little policy attention over the years. And with the COVID-19 pandemic, we have suddenly realized, oh my, it's not only one pandemic that is unfolding. We have many layers of the pandemic. For example, 1.5 billion people experience hearing loss, of which 430 million require rehabilitative services, be it clinical or any other rehabilitative service for them to participate in the community. This need, of course, is likely to rise, and by the year 2050, we'll be staring at 700 million people. This is not a small number, considering the resources that go to ear health. Of course, and unfortunately, the unacceptable rule of 80% holds even here. As you may know, in many health issues, even if you don't know the figure, if you just say that 80% of the people or 80% of that disease is found in middle and low and middle income countries, you'd probably be right. And even here in ear health, you are right, that nearly 80% of those with hearing loss live in low and middle income countries, where services for ear and hearing care are commonly lacking. And for us, when you look at the risk that is there for hearing loss, it stretches across the entire lifespan. From little babies just after birth, from the teenagers and youth, from the people at the middle who listen to a lot of music, workers who work in very noisy environments, and to the old who have other unique challenges across the entire spectrum. It would be unfortunate for me not to put this in perspective in terms of numbers. The young people that are at risk of permanent hearing loss due to the recreational listening of music at loud volumes is a pandemic. It's a whole billion of young people who are staring at challenges with hearing because of purely the kind of listening habits that they have. Of course, 200 million people, also mainly children, suffer from middle ear infections that can be prevented and treated. And we will look at these across the entire lifespan. If you look at access to interventions for hearing health, you will notice that across all the globe, there is a big treatment and access gap, ranging from about 80 to about 90%. Low and middle income countries and upper middle income countries, all of them have close to 90% of service gaps. This is just if you use one marker, for example, a tracer element like as access to hearing aids. There's a big gap, and I'm sure, Victor, you can talk to this because you deal with this day to day. Now let's look at ear and hearing care and the COVID-19. There has been evidence here and there, a bit sketchy, but now it's starting to be put together. But COVID-19 also was affecting the hearing, and this is a novel virus, and we barely have understood it. And so we're starting to see, especially long-term hearing complications of people who have suffered COVID-19, and this is yet to be documented fully, so I'll just mention it here. But of course, the biggest burden that we have had with COVID-19 is the disruption of the primary healthcare for ear, disruption that has been occasioned by the pandemic and the response thereof. There's a lot of max anxiety, and I'm sure some of my colleagues who live with hearing challenges will tell us the anxiety that is caused by when everybody around you is now wearing a mask. You're used to reading people's lips, but now here you are, you feel like you're in a forest where you cannot understand anybody because everybody is having a cloth mask and it is mandated by law. Of course, there has been challenges of loss or damage to hearing aids or cochlear implants that have been occasioned by the masks that we wear with elastic bands that are hooked right out behind the ear. And again, our colleagues can probably speak better to this than me. And of course, there's been a poor access to information. Now, the question that begs is, what happens in terms of if we were to respond to these unaddressed agenda. You will notice in the report that will be launched that close to $980 billion is lost every year when we have unaddressed hearing loss, and this impacts stretched across the entire community. It affects education, it's about employment, social isolation is a big problem when there is an unattended hearing needs. There is interpersonal relationships that are affected, issues around mental health, cognition, identity, and a lot of stigma, language and speech development. And when we talk about response, we are talking about spending close to maybe $1.3 to $1.5 per capita extra of what we are spending currently as government. And the return on investment as envisaged in this report ranges from $2 to about $16 for every dollar we invest. And so I think it is worth the while for us to invest in hearing health. Let me just look at this across the life course, for it is possible through the entire life course. And we know that this can be done through three main interventions that will be spoken to through that report. One is preventive action. And as you know, preventive action mostly has a big return, especially in children. As you know, about 60% of the hearing loss attributed to preventable causes amongst children, things like rubella, low birth weight and prematurity, birth complications, meningitis, and ear infections can be prevented at the newborn and children level, preventing a big chunk of hearing loss. Of course, as we come to the teens and adults, issues around loud music and working environments that are very noisy. There are issues around lifestyle choices, issue around trauma. And as you go towards the older people, then you are talking about regular hearing screening and issues that come with age and access to hearing aids. Let us look at these challenges through the building blocks, as you may know them, 5 building blocks. And there is a lot that we can talk about, but I won't spend so much time on it. But for example, in leadership and governance, there is very little policy attention that is attributed to ear and hearing health. And we need to change these. There's issues about oversight and accountability. The globe makes very quick commitments. For example, in the SDGs, in the UN high-level meeting for NCDs, a lot of commitments are made, but how much follow-through is there? We have issues of coalition building with non-state actors and the NGOs and the university, and all those sectors, they have an input to put in. The health workforce is lacking for ear health. Victor and team, we need to diversify and increase the quota of training for health workers who can treat ear infections and also can give advice on ear health. And this does not have to be doctors only and specialists. We need to innovate and probably train some nurses and middle-level healthcare workers, community health workers, and even people living with hearing challenges, because they are a strong force that we can use to assure and ensure that health reaches people in the community. There are also other innovative mechanisms like telemedicine, task sharing, that would make sure that ear health reaches the far-flung parts of our country. Medical products, of course, there is a big challenge about access. I don't know if South Africa, I need to check whether we have an essential list for ear health medicaments and essential technologies that would make procurement easier and would make prescribing a bit easier. I don't know that, we need to check that, but that is cut out for us as recommendations from this report. And on we can look at health information, and even financing is a big challenge. Issues around social protection. Do the people with hearing challenges have social safety nets that protect them from financial catastrophe? Issues about engaging the non-state actors. And so this report takes on mnemonic of hearing that looks at all these challenges and summarizes them in about 7 interventions. First is hearing screening and interventions need to be upscaling. Ear disease prevention and management is a big intervention that can save us a lot of burden. Access to technologies, this one is a big one, and we need to make it easier for import and for use and for tax breaks, and all these need to be thought about. Rehabilitation services, very important, improved communication, noise reduction, and issues around occupational health and greater community engagement. This report, you will see it today. There'll be a lot of noise in the internet, in Twitter, in Facebook. Those of you who are tech savvy and are in Facebook and Twitter, please participate in the hearathon that is going to be happening in the next 24 hours as this report is being launched. This report will be looking across 320 targets, if I may call them. One is we want to increase the effective coverage of newborn hearing screening by about 20%. We also want to move member states and all the other partners towards relative increase in the effective coverage of adults with hearing loss that use hearing technology. So we want to improve access to hearing aids and implants. And finally, we also want to reduce by 20% the relative, the prevalence of chronic ear diseases that go unaddressed, especially in the school-going children that cause a lot of hearing challenges. Now, let me finish by looking at some recommendations. And I've divided them into 4. Recommendations that go to the Ministry of Health. We need to include people-centered ear and hearing care in universal health coverage. There is nothing about people with hearing challenges without them, and they must be part and parcel of the universal health coverage debate. Not only the debate, but it has to be seen that their challenges are taken care of. We strengthen health system to deliver the integrated people-centered essential health care for hearing. And also, this should be at all levels, especially at the primary care level. Of course, we need to undertake awareness campaigns. We need to determine targets and monitor national trends, because if you can't measure a problem, you can't do anything about it. If you want to look for data on hearing and ear health in these countries, big challenge. So we need to improve our surveillance. Of course, promote high public health research. All the guys in the universities, there you have your work cut out. The international non-government organizations, we need to align and support the WHO and also the member state, South African National Department of Health, to be able to deliver this. This is a big task and they cannot deliver it alone. So we ask for non-government organizations, the individuals, non-state actors to hold hands with us to be able to deliver this to the next level. And of course, to take steps to improve knowledge, attitudes and practice with respect to ear and hearing care. There's a big gap in knowledge and awareness. Stimulate generation of and dissemination of knowledge, not only dissemination, but also translation. And the universities, you also have a big role here. Research is churned out, but it needs to be translated for policymakers to be able to use it in a palatable manner. And of course, participating actively in global action for ear and hearing care. Other stakeholders, colleagues in the non-state actors and NGOs, you need to support the government, you need to contribute to the knowledge, you need to collaborate to ensure all stakeholders can contribute and have a common vision. And of course, highlight the important and needs to ensure that ear and hearing care are given the priority. I will finish with you guys in the academia, Victor and team. You need to stimulate the generation and translation and dissemination. And I put a mark on translation because research is churned out, but it needs to be translated to language and a level which policymakers can use it. Increase the training quota. We need more training for ear specialists. And of course, you need to lead from the front and make your institutions, like if I visit your institution, and I would want to see it being a health promoting environment and promotes ear and also reduces stigma for those who have challenges with hearing. And also I would want to see there's some work in incubating innovations and cutting edge research. So we have a lot that we can do with the universities. I will finish with this quote because indeed hearing protection is a sound investment. So it's been a pleasure to have you guys. Thank you for those who organized it, and I'm here to answer a few questions. Thank you.
That's absolutely wonderful. Thank you so much, Dr. Mwangi. And we've got lots of people in the chat asking if you can share your slides later. And you've handed the baton right over that challenge to Dr. Victor de Andrade. So right over to you, Dr. Andrade.
Hey everyone, and thank you very much, Dr. Mwangi, for joining us, and thank you to all the other panelists also for your very valuable contributions. And the points that Dr. Mwangi has made are definitely taken on board, and I'd like to reassure Dr. Mwangi that a lot of what he has suggested is already in process. Having said that, let me share with you some thoughts on some of the topics that we were discussing today. And so I thank you for joining us on this special day. We highlight the value and need for ear and hearing care. Health and hearing is not reserved for today only. Today is a day in the calendar to emphasize that which we ought to do every day. That is, to be considerate of our own and others' ear and hearing health. The theme Hearing Care for All is a call for justice and access to ear and hearing care. In South Africa, where widespread inequality still exists, there is a need to demonstrate the respect and also dignity for people who have ear and hearing difficulties. This human rights focus ought to guide us in our endeavors, even more so in the context of extreme vulnerability within which many of us work. This human rights approach is necessary in the fields of deafness and audiology to address the stereotypes, citizenship principles, failures in communication, unequal power relationships, inclusion, and representation. The audiological results do not define people in that they only provide a very limited description of the consequences of hearing loss. The effects vary from individual to individual and can vary widely over time, even within a given individual. And so, the focus of audiological interactions ought to be people, not the audiological results. Cognizant of this foregrounding of personhood, we need to remain mindful that people are not completely and wholly defined by the deafness. People have other characteristics, traits, dimensions, and personalities, all of which interplay with their deafness. Under apartheid, segregationist policies meant that deaf people were caught in a system of segregation within the larger system of segregation, where deaf Black children only had access to schools in demarcated areas for Black people, which were very far away and mostly did not reach high levels of education. Children were only taught to stand at 6 or grade 8 in academic subjects, and thereafter, if they continued in school, they were only taught technical skills, which did not necessarily prepare deaf people for employment. In South Africa, it is reported up to 70% of deaf people may be unemployed because of limited infrastructure for many deaf people. Furthermore, in South Africa, for deaf people, the linguistic, sociological, philosophical, historical, and educational particularities are shaped by poverty and economic constraints. I propose a consideration for the personal and human rights perspective that is concerned with the lives behind the numbers, behind the measurements, behind the statistics. We need to be looking at the human dimension, that which is essential. And so the World Hearing Report is being launched today at the WHO in Geneva, and the Ndlovu Youth Choir were invited and accepted the invitation to be champions for ear and hearing care. And a special performance for today's launch was prepared to celebrate. At the end of this presentation, we may have a treat for you when you can watch the Ndlovu Youth Choir's World Hearing Day performance of the songs selected to commemorate this day and to launch the World Hearing Report. This report will talk to various themes, one of which is why hearing matters, hearing across the life course. So to touch on what Dr. Mwangi was referring to, please let me focus on this aspect for a while. The early identification of deafness is not just about the identification and diagnosis of deafness, but crucially about the subsequent information sharing, psycho-emotional support, resource sharing, and access to deafness-related and support early on in people's lives. Early intervention relates to the whole life course. There is a need, for example, for the early identification of noise-induced deafness, age-related deafness, ototoxic deafness, amongst others. However, for this webinar, I'm going to talk to early childhood intervention in deafness. A comprehensive newborn hearing screening program, for example, means that parents and caregivers of deaf children can be more informed in terms of language, schooling, support, and other options for deaf children. At first, and on the surface, the promotion of a newborn hearing screening program may seem to favor the medical model agenda in terms of diagnosing deafness and labeling deafness. However, I suggest that early identification, congruent with the social model and with the promotion of South African Sign Language, because early identification suggests that the early development of language, any language, be it SASL or spoken language, is crucial. The context of poverty can preclude opportunity for hearing care for all. In South Africa, where 20% of the population lives on less than 500 Rand per month, and people already face economic and financial challenges, costs generally associated with diagnostic and rehabilitative audiological services may be a barrier to all but the most privileged individuals in developing countries. COVID-19 has further exacerbated the challenge experienced by people who are deaf through even further exclusion. The theme for today is hearing care for all, but considering the foregrounding of COVID-19 priorities focused on screening, testing, vaccinating, other pressing issues have moved to the background due to the global pandemic. And in contexts such as ours of scarce and competing resources, right now, there is a great deal of time, energy, preoccupation, money, and activity focused on COVID-19, and rightly so, because of the life-threatening risks associated with it. However, what it may have done too, in our context of limited resources, is to have redirected the time, energy, preoccupation, money, and activity away from ear and hearing care services. The news reports of the misappropriation of funds meant for COVID-19 suggest that funds may now need to be sourced from other services which may be deemed to be less life-threatening. For example, in a recent analysis of Minister Mbowene's February 2021 budget, it was reported that accounting for inflation, the spending on public health will decrease by 12.5% over the next 2 years, and that the health budget as a whole will be cut by 15 billion rand over the next 3 years. Moreover, the report quotes Section 27 in saying that government must expedite the procurement of vaccines without cutting costs for other crucial programs. Therefore, besides the communicative exclusion offered by masks and telecommunication, deaf people in South Africa risk further marginalization during these trialing COVID-19 times. So, what is the role of universities in advancing ear and hearing care for all? University clinics can go a long way to offer services to underserved communities. For example, at Wits, the University Speech and Hearing Clinic offers a range of services for people with speech, language, and hearing difficulties. The Audiology Clinic offers services related to the assessment and rehabilitative options for ear and hearing and balance difficulties, amongst others. Universities play a pivotal role in promoting hearing care for all, not only in the formation of students and in research endeavors, but also in the opportunity to bring to bear different thinking to establish notions and thereby facilitate change. In my opinion, universities offer an opportunity to explore the human dimension of deafness, not only the decibel levels, the signal-to-noise ratio, percentages, logarithmic scales. Universities can be springboards for practice and engagement that is considerate of gender, language, race, ethnicity, belief systems, income, social class, and education, amongst others. Although it is acknowledged that some of the foundational work in audiology is based within the field of medicine, there is the need for a more personal approach to deafness, thereby creating a balance with the biological, physiological, epidemiological, and medical aspects of deafness in South Africa. This balance is necessary because it offers the opportunity for a fuller and more meaningful view of the deafness experience. Universities also offer opportunities for an interrogation of people's cultural, historical, and personal experiences, so that cultural competency is not reduced to a technical skill, replete with a list of do's and don'ts. It may run the risk of stereotyping people, especially because culture is not a monolithic phenomenon, nor is it a homogeneous or static one. We need to account for factors in the person's life. And so, because universities can offer opportunities for the inclusion of qualitative aspects of audiology, ensure that background, meanings, motives, reactions, and outcomes are assessed from many angles, especially because audiology is interdisciplinary and has borrowed perspectives, knowledge, and skills from disciplines across the area. Universities are well positioned to stimulate today's students, that is, tomorrow's clinicians, policymakers, practitioners, advocates, teachers, academics, amongst others, to, in addition to thinking, philosophizing, contemplating, also putting into practice and policy that which is real and necessary when it comes to hearing care for all. Considering South Africa's history, in our interaction with deafness, we can do well to remember Bandura when he said, "As a society, we enjoy the benefits left by those before us, who collectively resisted inhumanities and worked for social reforms that permit a better life. Our own collective efficacy will shape, in turn, how future generations will live their lives. The times call for a commitment of collective effort rather than litanies of powerlessness that instill beliefs of inefficiency to influence conditions that shape the course." Thank you very much.
Thank you so much for those thoughts, Dr. Victor de Andrade, and also a call to action rather than only criticizing, victim holding, or philosophizing. And so that's also a baton, as I see it, being handed over to our wonderful next panelist, Dr. Hilton Bauer. As I already indicated earlier, he's a person living with profound deafness and bilateral cochlear implants, and he's bringing to us real life exposure and experience, but also his input in shaping the world. Over to you, Hilton, for your presentation. And I'd like to kick off by asking you a question. Today is a day about justice and access to hearing care for all. What do you see as the major challenges and also facilitators in that great goal that we all join in today?
So like we said, I'm a bilateral cognitive implant. I'm sure a lot of people in this webinar would like to ask me a lot of questions. So I'm a privileged person, and I'm lucky to be able to benefit from technology of cognitive implants. It's a life-changing devices, and I wouldn't imagine my life to be as it is right now and getting this far without the help of cognitive implant. So on my right here, I'm wearing a cognitive implant product. It's called the N7, the nucleus implant, and we've got the ear hook, which help me to keep it on my ear, and especially when I'm wearing a mask out in public. So now you can see I'm wearing behind the ear cognitive implant. On my left here, I'm wearing another product, and it's called the Cancel. This is about the Cancel on the plaque. Okay, there's Cancel on my left here, and it's quite completely different from the right here because the technology has changed a lot in the last couple of years. Fun fact, I just graduated just 1 week ago on the Cancel, and I'm still trying to get used to technology. Because it's not sitting on my ear, so I feel like the whole weight has been left off my neck here. Yeah. Being a bilateral cognitive implant is does come with a challenge because I have to constantly monitor my cognitive implant, look after it, and make sure it's in good condition. I have access to an organization in Johannesburg called the Cognitive Implant Center. Yeah, JCIC is what it's short for. Basically, it's got a team of audiologists and speech therapists and other professionals in hearing care who can help me with finding a cognitive implant part, like battery, spare part, and if anything goes wrong, I can call them or email them and book the appointment for maintenance and to check what the technical issues are, troubleshooting, and all sort of things. So, like I said, I'm a privileged person. Not every person with hearing aid or cognitive implant have access to those kind of services and technology, or have a financial means to afford the technology that is quite very expensive. On my side, I have an app on my smartphone called the Nucleus Smart app, which actually helps me to monitor my cognitive implants and also check on the device like the battery life and whether it is working fine and if there are any technical issues. So it's actually helping with notification. So with access to hearing care, like any person with hearing aid and cognitive implant, we need a backup plan when something goes wrong. So I have my own personal kit bag, which is a small pouch with a chargeable battery to charge my cognitive implant, a microfiber cloth to keep it wiper clean, and disposable batteries to help me keep up with everyone if my battery runs flat. And I have like 7 rechargeable batteries to keep my cognitive implant going because I stream a lot of chords and music to my ears and I really enjoy it. Yeah, for some of you who are not familiar, I don't really hold a phone and like talk like normal people. I basically stream a whole thing to my brain, so it consumes a lot of power, and that's why I need a lot of battery to keep my cognitive implant working. I also have spare part like microphone covers, yeah, cord magnets, all this stuff. So if anything goes wrong, especially during a pandemic, I don't have to worry about delay in delivery and having to go to hospital. So I can rely on my own backup kit to keep me going. And luckily for me, I didn't have to spend a lot of money on buying spare part, because if we keep a cognitive implant in the TVA in a good condition, they will last very long. Yeah, I'm also have access to private medical aid, which help me to upgrade every 3 years to a new cognitive implant model and technology, and it also help cover the cost. And then I'm paid to the premium monthly. So yeah.
That was such a vibrant and hope-filled presentation. That was really informative. Thank you so much for that, Hiten. I have one more question for you, though. During the time of very heavy mask wearing in the public domain that Dr. Mwangi and Dr. de Andrade have spoken about, were there any particular challenges for you, even despite your very advanced cochlear implants and your other audio device? Were there challenges for you because you couldn't do lip reading and it was more difficult to hear people's muffled voices? Maybe you could speak to that for a minute or two. We'd really appreciate that.
Sure. So I had cognitive implant for exactly 15 years now. Like I said, it changed my life, and I had to learn how to speak slowly and cut down on the breathing, and be able to train my brain to listen and recognize sound and words. So when COVID started, it changed everything completely. People have to start wearing masks. They have to do Zoom call, video call, and all those kind of ways of connecting without meeting in person. It got quite difficult at first and challenging. Initially, you are hesitant about change and you don't want to adapt or move on with the time, but you are forced to do it. Initially, I was afraid of being calling with a group of people because it's so similar to having a conversation around the table with more than two people, and the conversation keep bouncing from one speaker to the next speaker. So it's hard to keep up. I would prefer a one-on-one face-to-face conversation or a one-on-one person video call. But over time, I just kind of force myself to adapt and learn how to deal with video calls like this and speak to different people at the same time. Yeah, so that digital divide is one thing that I can learn. The other thing, when you are wearing a mask, I just noticed that the mask actually muffle the sound. So to the point where you can't hear the other people speaking clearly, you have to constantly ask them to repeat or talk louder. And a lot of people don't realize that we are not the people with hearing loss are not the only one who had to struggle with it. Even the hearing people have to struggle, because I've been asked many times to repeat, to talk louder, maybe lower my mask or stand a bit further away and just talk clearly. People don't understand when I speak with the mask on. And also the mask actually just closing the mouth, and it makes it difficult for you to breathe and to speak clearly. So somehow we have to find a way of like maybe stitching a mask differently on the side, or the design of a mask differently to just allow us to speak clearly and breathe easily. I just noticed that by talking to a lot of people with masks on, because I couldn't lip read, my brain is actually being forced to listen and to use all the therapy exercise to actually make out the words. And so I realized that my lip reading has just gone down by almost 0%. I mean, normally I do 30% reading, 50% listening, but now it's 100% listening. And it does help me in some way. I don't have to put so much energy and focus on really someone else. I just have to listen to them. And it's quite interesting for me because I never thought I would be able to listen 100% without having to read. And on top of it, I had to deal with a lot of phone calls, and I deal with contractors, I deal with different people on my architectural project. A lot of them those are not aware that I have a hearing loss, I'm very cognitive implant, so they talk to me like I'm any other person. And I'm able to follow the conversation clearly and answer questions and handle phone call. And I mean, the last 2 weeks I've been handling hundreds of phone calls, and I'm really shocked about how easy it is for me to handle phone calls despite my hearing challenges. And when these people actually meet me in person, they also quite shocked. They're like, "Hey, wait a minute, you are a deaf person. How is that possible that you can talk to me on the phone and everything?" So I think that the upside to the COVID pandemic, it actually forced us to adapt, learn new strategies of coping with hearing loss, and looking after our hearing devices as well, and actually how about to push up our listening skills and speech skills because we actually got the time to listen, to speak clearly, watch movies, TVs, listen to music, and exercise our brain in some way that we can pick out sound and speeches and words, and yeah.
Hiten, really, you really are inspiring all of us, those of us who've got moderate hearing loss, those of us who don't have any hearing loss, but have really paid more attention to sound and speech, and even the sound of our own breath, and also the sound of the world around us. You are truly moving us across technology, access, aesthetics, beauty, courage, hope, attention. Straight after you, Hiten, our colleague who is a sign language expert in the country, Ms. Ketukutula Makutsane, coming in.
With millions and millions of people losing their hearing every day, I feel it's important that we do a lot of awareness, because especially in our Black communities, because if somebody goes deaf, if somebody has an ear problem, we'll use cooking oil and pour in the ear, things like that people should stop doing, and because it can cause more damage to the ear. And also, if there's more awareness in ear care and things that the do's and the don'ts, because most people use the earbuds, and our kids, they see us growing up, they grow up seeing us using the earbuds and think, oh, this is the right thing to do, but actually it's not the right thing to do. So what they say is, if it's smaller than your elbow, then it doesn't go inside your ear. So those are the messages that we need to be teaching our kids. So I think we need to be going to schools and educating our kids, maybe add ear care subject, or during LO class, they add things like that. And because, I mean, if it's easier to prevent than to cure, because curing is expensive. So I think also we can work with organizations like High Hopes, educate people on ear care, and also when we have Deaf Awareness Month, I think normally Deaf Awareness Month, we tend to focus solely on the deafness. We tend to focus on sign language and deaf rights and so on. But maybe we can also incorporate ear care, because it's the whole month. We use that month to go to schools and educate kids. We go to clinics. If we can have audiologists going to clinics as well to educate our parents, our grandparents, and people going to clinics, or even going to clinics for checkups, say once a month. If the government can also fund some of the activities that happen during Deaf Awareness Month, but not just fund the sign language and the deafness, deaf culture events and stuff, but also fund taking care of our ears and education and awareness. I think that is also very important. So I feel it's important that we fix the problem earlier, because if now a person goes deaf, now they have to go to now learn a new language, which is sign language. If I go deaf now, and I don't know sign language, how am I going to communicate with my family, with my people, with my colleagues? So in a way, I will not be able to get a job. You know, my employability will go down, and because they think it's expensive now to hire you, because we have to hire an interpreter. Interpreters are expensive. So I think it's very important that we try and fix the problem before the problem happens. Just to add on the employability part, then a deaf person who wants to open a company, information, where do they get information about how to open a company? Like, you know, things like that. So it becomes a problem later, you know, while we could have saved that person from the word go. So when I talk to deaf people that I interpret with, so normally I'll ask, when did you go deaf? So normally most of them will be like, no, I went deaf later in life. They were not born deaf. So it's important that if they had known earlier, because some of them be like, no, I was sick, but then again they don't know why, what is it that they had. So if they had known earlier that I have a problem, and their parents stood up immediately and went to the doctor, got help and assistance, and again, especially when you go to the rural areas, there's no information. Even when a child is born, the child might be born deaf, but then the sisters, the nurses at the maternity ward, they don't know how to, they wouldn't be able to help the parents with, now you have a deaf child, so these are the things you need to do. Do you accept the deaf child as a deaf child, or do you want to fix the hearing problem? So again, there's that deaf culture, and there's that, we have that pathological view of deafness. The cultural view, pathological view. This view says the child is deaf, born deaf, it's fine. Let's teach the child sign language. Let them go into the deaf community. Let them learn sign language. Let them be a proud deaf person. Let them associate with deaf people. Then we have this pathological view where we feel we need to fix. And then also I think universities should also play a part, because now some students, they go through school, high school, and everything until they get to university. But then when they get to university, they don't even know they have a problem. They sit in class, they can't hear properly, they think, it's nothing. So if maybe there was a way of testing students, if there was a free service that students, when they come to the university, like it's just advertised, everybody knows about it. If there's a free service, then students can go test that, and then, you know, it will be easier to identify early. Then the students can get the hearing aids and then pass the university at the university. And again, in deaf schools, education in deaf schools, some of the deaf schools is not that great. So in a way, it blocks the deaf child from entering university. So most deaf people, they drop out before they even get to high school. Some, they get to high school, but then because of the situation in schools, so they drop out. So I think we need to do more education, more awareness, more education, more awareness in our communities, so that people they are aware where to go. If I have a problem with my ear, where to go, clinic, doctor, you know, like we should learn more about the free services, because most of our people do not have jobs. So I think it can really help assist the community at large. Thank you.
And I would like to just end by saying that you'll remember that Dr. Victor de Andrade pointed out that the world-famous South African and Global Youth Choir responded to the call to create a piece of music for today. And we've been allowed to add a link to their video at the end of this show. So we'll move over to that. Kelebogile, our technical assistant, will put that up. And without further ado, if you could just open your cameras, and we can thank you all for your contributions today, starting off with Dr. Mwangi, who gave us an absolutely exemplary overview, in fact, of the whole field of study and great challenge to us academics. Dr. Victor de Andrade, who brought technical skill and heart as an educator and a clinician to the process. my colleague David Segkwele, the curator at Adler, who looks after a huge collection of old hearing aids, audiological equipment. I know he's going to be asking you, Hitten, to actually donate all of your devices every 3 years when you get new ones, so we can really have a world-class set of fantastic instruments for young people in the country to come and look at over time. And of course, I thank you, Hitten Bauer, for giving your personal experience. And to everybody involved in the team today, thank you as we roll out with the Ndlovu Youth Choir. Thank you, and justice and hope for the hearing disabled and for all of us on the hearing wellness spectrum today. Bye-bye.
I see trees of green, red roses too. I see them bloom for me and you, and I think to myself, what a wonderful world. I see skies of blue and clouds of white, the bright blessed day, the dark sacred night, and I think to myself, what a wonderful world. The colors of the rainbow, so pretty in the sky, are also on the faces of people going by. I see friends shaking hands, saying, how do you do? They really saying, I love you. I hear babies cry, I watch them grow. They'll learn much more than I'll ever know, and I think to myself, what a wonderful world. Yes,